This morning, before you made your coffee, before you checked your phone, before you did anything else, your body was already sending you a message, not through pain, not through a dramatic symptom that sends you rushing to the emergency room, but through something so ordinary, so familiar, so completely overlooked that most people dismiss it before they even realize what they are looking at: your hands. The two instruments you have used every single day of your life, and after the age of 60, those hands begin to speak a language that most people never learn to read. Today we are going to learn that language together, because what your fingers, your nails, and the veins running across the back of your hands are showing you right now could be the earliest warning you will ever receive about your heart, your kidneys, your liver, your circulation, and your immune system. Not a guess, not a theory. Medical science confirmed, documented, peer-reviewed. This is what your hands are trying to tell you. Let us start with something so simple it sounds almost too obvious. Look at your fingernails right now, not the polish, not the shape you prefer. Look at the color, the surface, and what is underneath the nail plate. Because the nail is one of the most transparent windows into your internal health that your body possesses, and after 60, the signals it sends become more frequent, more specific, and more urgent. The first thing we are going to talk about is called Terry's nails. When the doctor who first identified this condition, Dr. Richard Terry, began examining patients in the 1950s, he noticed something that nobody before him had formally documented: more than 8 out of every 10 patients with severe liver scarring, a condition called cirrhosis, had nails that looked almost completely white, not pale, not light, white like frosted glass, with only a thin reddish-brown strip remaining at the very tip of the nail. The normal pink color of the nail bed was completely washed out. He documented this, he published it, he named it, and decades later the medical community confirmed what Terry suspected. This specific nail appearance, white or washed-out nail bed with a narrow reddish-brown band near the tip, is now recognized as a potential indicator of liver failure, congestive heart failure, kidney failure, adult-onset diabetes, and viral hepatitis. A 2017 study titled Terry's Nails, A Sign of Systemic Disease, confirmed that while this pattern can sometimes be associated with normal aging in a significant number of cases, it points directly to serious underlying organ dysfunction. If you are over 60 and your nails look white, not pale, not light pink, genuinely washed out, and you notice that thin brown or pink strip at the tip, that is not a cosmetic issue, that is your body flagging something deeper. Now look at one of your fingernails and imagine drawing a horizontal line straight across the middle of it. If the half closest to your finger near the cuticle appears white or pale, and the half closest to the tip appears reddish-brown or darker, and that division is sharp and clear like a distinct border between two colors, you may be looking at what doctors call Lindsay's nails, also known medically as half-and-half nails, and the condition connected to this specific pattern is one of the most commonly missed diseases in adults over 60 in the United States today: chronic kidney disease. Research published in medical journals confirms that between 20 and 50% of patients with chronic kidney disease develop this distinctive half-and-half nail pattern. The reason it occurs is understood: when the kidneys begin to fail, waste products that should be filtered out of your blood begin to accumulate. Nitrogen compounds, urea and creatinine, build up in the bloodstream. This toxic buildup affects the blood vessels beneath the nail bed and changes the way pigment distributes under the nail plate. The result is that sharp horizontal color division, pale near the base, darker near the tip. What makes this particularly important is the word that doctors use most often to describe chronic kidney disease in its early and middle stages: silent. Most people with chronic kidney disease do not know they have it. There are no dramatic symptoms in the early stages, no pain, no obvious signs. The kidneys quietly lose their filtering capacity over months and years, while the body offers only the most subtle external clues. One of those clues is the pattern on your nails. If you see a sharp horizontal division in your nail color, pale on the cuticle side, darker on the tip side, and that pattern appears across multiple nails, that is information worth taking to a doctor. A simple blood test measuring urea and creatinine levels can confirm kidney function within hours. Now look at your nails again, but this time look underneath them, not at the surface of the nail. Look through the nail plate at the tissue beneath it. Do you see any thin, dark lines, thin as a hair, running vertically from the base of the nail toward the tip? Lines that look like tiny splinters of wood trapped beneath the nail? If you do, and you have not recently injured your finger, you are looking at what the medical community calls splinter hemorrhages, and depending on how many there are and whether they appear across multiple nails, they carry a message that deserves serious attention. Splinter hemorrhages occur when the tiny blood vessels, the capillaries beneath the nail, are damaged. They bleed in a narrow linear pattern along the direction of nail growth, and the condition most closely associated with this finding in adults over 60 is a bacterial infection of the inner lining of the heart, a condition called endocarditis. In endocarditis, bacteria enter the bloodstream through a cut in the skin, through dental work, or through a medical procedure, and they travel to the heart where they attach to the heart valves and begin to grow. As small clumps of bacteria move through the bloodstream, they damage the tiny capillaries in the extremities, including the capillaries directly beneath your fingernails. The result is those thin, dark, vertical lines. This is not a remote theoretical connection. Medical textbooks classify splinter hemorrhages as a clinical sign of endocarditis. They do not fade when you press on them. They are not caused by pressure or impact to the nail. A single splinter hemorrhage on one nail in a person doing heavy manual work is not necessarily alarming, but multiple splinter hemorrhages across multiple nails in a person over 60 who has recently had dental work or a procedure is a finding that warrants same-week medical evaluation. Endocarditis, when caught early, is treated with antibiotics. When caught late, it requires open-heart surgery. The line between those two outcomes can sometimes be as thin as the line beneath your nail. Now let us move from the nail plate to the nail shape itself. Hold your hands in front of you with your palms facing you. Look at the tips of your fingers, specifically at the angle where the nail meets the finger at the base. Normally there is a small visible gap, a diamond-shaped space, when you press the backs of two corresponding fingertips from opposite hands together. If that gap has disappeared, if the base of your nail has become rounded, puffy, and spongy feeling, and if the tip of your finger itself appears enlarged, wider, and rounder than it used to be, you are looking at a finding called nail clubbing. Nail clubbing, when it develops after the age of 60 in someone who did not have it before, is one of the more serious signals that hands can produce. It is associated with conditions that reduce the amount of oxygen being delivered to the peripheral tissues. The list of conditions linked to clubbing includes chronic lung disease, particularly lung cancer, and pulmonary fibrosis, chronic heart conditions in which the heart is unable to maintain adequate oxygen delivery, and certain gastrointestinal conditions involving chronic inflammation. The mechanism involves the accumulation of proteins and growth factors at the fingertip, triggered by the body's attempt to compensate for chronically low oxygen levels. The nail bed becomes fibrous and swollen. The angle of the nail plate gradually changes. The fingertip takes on that characteristic rounded, drumstick-like appearance. This is not a subtle cosmetic variation. Clubbing, when it develops in adult life, belongs on the list of reasons to see a physician, not someday but this week. Let us move now from the nails to the skin of your hands. Turn your hands palm side up and look at the creases across your palm, the lines that run horizontally across the surface. In a healthy person, those lines carry normal skin color, but in certain conditions, particularly conditions affecting the liver, those palm lines can develop a distinctive reddish color. The medical term is palmarerythema, redness of the palms, and when the redness is concentrated specifically in the creases and lines of the palm, it is one of the clinical signs associated with liver dysfunction. The liver plays a central role in processing estrogen and other hormones. When it is damaged by alcohol, by fatty liver disease, by cirrhosis, hormone levels shift, and one of the places that shift becomes visible is the skin of the hands, particularly the palm and the skin near the base of the fingers. Palmarerythema can also be associated with rheumatoid arthritis, thyroid conditions, and pregnancy. But in a person over 60 who drinks regularly, who has elevated liver enzymes on past tests, or who carries risk factors for liver disease, redness concentrated in the lines of the palms is not something to attribute to warmth or sun exposure. Now let us talk about the veins on the back of your hand. Look at them. They are more visible today than they were 20 years ago, and that is normal. As we age, the skin becomes thinner, the fat beneath it decreases, and veins naturally become more prominent. But there is visible and there is abnormally prominent. There is the gradual change of aging, and there is a change that happens faster than expected or in a way that is accompanied by other symptoms. When veins on the back of the hand become swollen, cord-like, tender to the touch, warm, and surrounded by reddened skin, that pattern has a specific clinical name: thrombophlebitis. Thrombophlebitis means inflammation of a vein, usually caused by a blood clot forming within it. When it occurs in the surface veins, it causes the visible redness, warmth, and that rope-like feeling along the vein's path. When it occurs in deeper veins, it becomes a more serious matter, with the risk that the clot could break free and travel to the lungs, the heart, or the brain. The conditions that increase the risk of hand and arm vein thrombosis in people over 60 include vascular insufficiency, a reduced ability of the blood vessels to move blood efficiently, which itself is associated with diabetes, high blood pressure, and high cholesterol, three conditions that become dramatically more common after the age of 60. If you look at the back of your hand and see veins that are not just visible but swollen, rope-like, tender, or surrounded by color changes, that is not the normal appearance of aging veins, that is a vascular signal. Now let us talk about finger swelling, not the swelling that happens after you sleep on your arm, not the swelling that goes away after you move around for 20 minutes in the morning. Let us talk about swelling that is present and persistent, swelling that is worse in one hand than the other, swelling that comes with stiffness. That takes more than an hour to improve, swelling that involves the same joints on both hands simultaneously, the knuckles of the index finger, the middle finger, and the ring finger symmetrically. This specific pattern of finger swelling, symmetric, morning stiff, gradual in onset, is one of the hallmark presentations of rheumatoid arthritis. And what most people do not understand about rheumatoid arthritis is that the disease they see in their hands is only part of what is happening in their body. Research from major medical institutions, including studies published in the Journal of the American Heart Association, confirms that people with rheumatoid arthritis face nearly twice the risk of developing heart failure compared to those without the condition. The same chronic inflammation that attacks the joints attacks the blood vessels. It accelerates the buildup of arterial plaque. It contributes to the narrowing of the vessels that supply the heart. So when persistent, symmetric finger swelling goes unaddressed, and when rheumatoid arthritis goes undiagnosed for months or years, the consequences extend far beyond stiff fingers. They extend to the cardiovascular system. There is one more hand sign we need to discuss, and this one deserves careful attention. Hold your hands in front of you and look at your fingertips. Try to straighten them as fully as you can. Do your fingers stay fully straight? Or do one or more of them drift downward, bending at the middle or outermost joint, refusing to straighten completely even when you try? When this involves the ring finger and the little finger and happens gradually over years, this can be the early presentation of a condition called Dupuytren's contracture. But there is a deeper reason this matters beyond the mechanical inconvenience. Research has shown a significant association between Dupuytren's contracture and a condition called transthyretin amyloidosis, a disease where an abnormal protein accumulates in organs throughout the body, including the heart. Cardiac amyloidosis, amyloid deposits in the heart muscle, can lead to heart failure, irregular heart rhythms, and thickening of the heart wall. And one of the places it announces itself years before a formal cardiac diagnosis is in the hands. Stiff, contractured fingers in an older adult, particularly when accompanied by carpal tunnel syndrome or shoulder stiffness, are sometimes the earliest visible sign of a systemic protein deposition disease. So let us bring this all together. What you do every morning when you look at your hands matters. The color of your nails, whether they are normal pink, washed out white, or divided half and half. The surface of your nails smooth or grooved with horizontal ridges. The thin dark lines beneath the nail that look like splinters. The shape of your fingertips, flat and normal or rounded and puffy. The redness of your palm creases. The appearance of your back of hand veins, normal or swollen and rope-like. The pattern of finger swelling, temporary and one-sided or symmetric and morning stiff. The position of your fingers, fully straightening or subtly bending and refusing to come back. None of these signs are a diagnosis. None of them replace a physician's examination and appropriate testing. But every one of them is documented medical science. Every one of them has been observed, described, published, and confirmed by clinicians and researchers. And every one of them represents a window, a moment where your body is offering you information before the condition it reflects becomes harder to treat. The kidneys give you this window, the heart gives you this window, the liver gives you this window, the immune system gives you this window. The question is whether you look. After 60, the body communicates differently. The loud, dramatic symptoms that force you to act, those come later. What comes first are these quiet, visible, easily overlooked signals. The nails you glance at every morning without really seeing, the veins you have stopped noticing, the finger that does not quite straighten anymore, the palm that always seems a little red. These are not signs of old age. They are a conversation your body is trying to have with you. Learn to listen. This is what your hands are trying to tell you. If this information helped you see something in a new way, share this with someone you care about. Subscribe for more evidence-based health information explained clearly and honestly. Every video we make is researched, verified, and produced with one goal: to give you information that matters before it becomes urgent. Stay informed. Stay aware. We will see you in the next one.